Welcome to the Explainer. Today, we're acting as medical detectives to unravel a condition that is incredibly common, yet somehow still widely misunderstood. We're going to unpack the complex biology behind it, decode those wildly frustrating symptoms, and most importantly, look at the science of how you can actually take back control. Okay, let's dive into this. If you are someone you know has been struggling with unexplained symptoms, one thing that stands out right away from the data is this massive number. Globally, 1 in 10, and by some estimates, up to 15% of females of reproductive age are living with this condition. You are absolutely not alone, and the sheer scale of this means it's a completely crucial topic for us to unpack together today. Now, you've probably heard it called PCOS, or Polycystic Ovary Syndrome, but it's increasingly being referred to by a much more accurate name, PMOS. That stands for Polyendocrine Metabolic Ovarian Syndrome. So why the shift? Well, because as it turns out, the main PCOS is kind of a misnomer. Get this, you don't even need to have cysts on your ovaries to actually have the syndrome. At its core, this is a complex hormonal imbalance causing irregular periods and excess male hormones, which we call androgens. Here is our roadmap for today's explainer. First, we'll start by decoding PCOS and PMOS. Second, the hormonal web unraveled. Third, spotting the hidden symptoms. Fourth, diagnosing the syndrome. Fifth, we'll look at the long-term health risks. And finally, we'll wrap up with taking back control. We'll guide you step by step from the internal biology all the way to actionable solutions. Section 1, decoding PCOS and PMOS. What is actually happening under the hood? To figure out what goes wrong, we really have to look at the baseline. Normally, the female reproductive system relies on this incredibly delicate, perfectly timed balance of hormones, like estrogen, progesterone, and androgens. And I absolutely love this analogy from the medical experts at the Cleveland Clinic. They say, these hormones are like an intricate web, and the function of your reproductive system relies heavily on its balance. Think about a spiderweb for a second. If you pull just one single thread too tight, the entire geometry of the web gets distorted, right? Well, that is exactly what happens in PMOs. One hormonal thread gets pulled, and the whole shebang warps. Section 2, the hormonal web unraveled, the root causes. So what exactly is pulling on those threads and disrupting that beautiful, intricate web in the first place? Well, the exact singular cause is still kind of a medical mystery, but researchers have nailed down 4 major culprits. First, high androgen levels. These are those male hormones that basically prevent the ovaries from releasing eggs. Next, and this is a massive one, insulin resistance. When your body can't process insulin correctly, your blood sugar goes up. This spike in insulin actually forces your ovaries to make excess male hormones, which then suppresses ovulation. We also consistently see chronic, low-grade inflammation in these patients, and finally, genetics. If your biological parent has PMOS, you are significantly more likely to develop it too. Section 3, spotting the hidden symptoms, the physical clues. This is where those internal root causes connect to the wildly frustrating physical clues that women experience every single day. But patients often suffer in silence for years with these seemingly disconnected symptoms, just not realizing they all stem from the exact same root. The high androgens cause abnormal, heavy hair growth on the face and chest, a condition called hirsutism. It also causes severe acne and even male pattern hair thinning on the scalp. Then, the insulin resistance leads to stubborn weight gain, skin tags, and dark patches in the creases of the skin. And of course, the lack of regular ovulation leads to irregular or completely missed periods, making PMOs literally the most common cause of female infertility. It's a heavy burden for sure, but identifying these clues is the first step to finally feeling better. Section 4, diagnosing the syndrome, solving the mystery. Because symptoms vary so wildly from person to person, I mean some have severe acne but normal weight, while others struggle with obesity but have perfectly clear skin, doctors use a very specific clinical framework to solve the mystery and make an official diagnosis. Step 1, the regular or missed periods. Step 2, signs of excess androgens. This can be physical signs, like the hair growth we just talked about, or proven to a blood test. And step 3, enlarged ovaries or a polycystic appearance on an ultrasound. So, the crucial point is, you don't need all 3 to be diagnosed. You only need to meet 2 of these 3 criteria. This is exactly why you could be diagnosed with PMOS without actually having a single ovarian cyst. Section 5, long-term health risks. The stakes. It is so important we shift the narrative focus here, because PMOS is often brushed off as merely a fertility issue or a cosmetic annoyance. But the reality? Managing this condition matters far beyond that. The data reveals a heavy, genuinely urgent statistic. More than 50%, that is over half of women with PMOS, will develop prediabetes or full-blown type 2 diabetes before they even reach the age of 40. The stakes of relieving that insulin resistance unmanaged are incredibly high. And let's look at how this builds across the rest of the body. That same insulin resistance and obesity greatly increases the risk for high blood pressure, unhealthy cholesterol, and cardiovascular disease. Furthermore, missing periods for long stretches of time actually increases the risk of endometrial cancer, which is cancer of the uterine lining. The syndrome is also linked to severe sleep apnea, depression, anxiety, and if a patient does get pregnant, a much higher risk of gestational diabetes and preterm birth. That pulled hormonal web literally impacts everything. Section 6. Taking back control. The empowered patient. But please do not lose hope. While PMOS is currently incurable, it is highly manageable. Treatment paths are completely personalized to your current life goals. Your doctor will basically fork your treatment based on one main question. Are you trying to get pregnant right now? If you are, treatments focus on inducing ovulation using oral drugs, injections, or even in vitro fertilization. If you're not planning for pregnancy, the focus shifts to protecting the uterine lining and managing symptoms using hormonal birth control and specific anti-androgen medicines to stop that unwanted hair growth and acne. And this brilliantly illustrates how treatment paths are so highly personalized to you. But regardless of which medical path you're on, lifestyle changes are the universal foundation of treatment here. Eating a low-carb, highly nutritious diet, exercising regularly, and maintaining a healthy body weight, these things directly attack that insulin resistance we talked about earlier. By managing your weight and what you eat, you can naturally help your hormones get back to normal levels. And what's really fascinating here is how modern medicine is crossing boundaries to help PCOS patients. Take Metformin, for example. It's a drug famously designed to treat type 2 diabetes. But because insulin resistance is such a massive driver of PCOS, doctors frequently prescribe it here too. By helping your body process insulin correctly and regulating your blood sugar, Metformin actually forces the ovaries to stop overproducing those male hormones. That can completely restore your menstrual cycle. It's just an amazing example of fixing the root cause to fix the web. We've covered a lot of ground today, from the root causes hidden under the hood, to the frustrating daily symptoms, right through to the personalized treatments available. You now have the knowledge to advocate for yourself or for the women in your life. So I'll leave you with this final thought. With 1 in 10 women affected globally, is it time for you to take a closer look at your own hormonal web? Thanks for joining me on this explainer, and keep learning.